form of internal bleeding in which blood escapes into a hollow organ and is usually discharged via a natural opening outside the origin of the bleeding, such as your mouth. It is the acute bleeding from the lung, from the upper respiratory tract, the trachea, and the alveoli. When evident clinically, the condition is usually massive. Signs and symptoms include general signs of hemorrhage such as skin pallor, diaphoresis, facial cyanosis, weak and fast pulse, and tachypnea. It also includes local signs such as massive hemoptysis consisting of foamy bright red blood, excessive cough, and chest pain. So to start off, there are three main steps, first aid steps when it comes to pulmonary hemorrhage. Number one would be airway protection and resuscitation. Number two would be locating the site of bleeding. And number three, controlling of the bleeding. So under the first step, protecting airway and resuscitation, any patient with massive hemoptysis, firstly, should be admitted to a monitored setting such as an ICU. Attempts should be made to determine the site of bleeding and the patient positioned with the bleeding side down to prevent aspiration into the unaffected lung. Blood loss should be treated with volume resuscitation, blood transfusion, and correction of coagulopathy. If large volume bleeding continues or the airway is compromised, the patient's trachea should be intubated with as large an endotracheal tube as is possible to allow adequate suctioning and access for bronchoscopy. So how this is done depends on the exact location of the bleeding and the damage. If the bleeding can only be localized to the right or left lung, unilateral lung intubation may protect the non-bleeding lung. So, in the case of right-sided bleeding, a bronchoscope may be directed into the left main bronchus, which can then be selectively intubated over the bronchoscope with the patient lying in the right lateral position. The left lung is then protected from aspiration and selectively ventilated. So right here I've put in a diagram explaining this method. Next would be, for a left-sided bleeding source, the patient is placed in the left lateral position and selective intubation of the right lung may be performed. But this may lead to occlusion of the right upper lobe bronchus. An alternative strategy is to pass an endotracheal tube over the bronchoscope into the trachea. A Fogarty catheter may then be passed through the vocal cords beside the endotracheal tube, directed by the bronchoscope into the left main bronchus and inflated right here. This prevents aspiration of blood from the left lung, and the endotracheal tube position in the trachea allows ventilation of the unaffected right lung. So here I've again added in a diagram. So an alternative strategy for unilateral breathing is passage of a double lumen endotracheal tube. Right here I've added the diagram of it. But usually to use this method, you should be very well equipped, and yeah, as it can cause poor positioning can actually cause further damage. So moving forward, the second step of first aid would be locating the site of bleeding. Precise localization of the bleeding site is vital. So we use two different methods. Fiber optic bronchoscopy and angiography are usually the methods that are used. But the go-to method usually is fiber optic bronchoscopy. So fiber optic bronchoscopy is the initial diagnostic procedure of choice in patients with massive hemoptysis because it can be performed at the bedside. It is readily available and it is often successful at localizing the bleeding site if it is performed while the patient is bleeding. You can also use rigid bronchoscopy because it provides a superior suction to maintain airway patency. So over here I've added some pictures explaining the two methods. You have rigid bronchoscopy and fiber optic bronchoscopy. I've also included an internal picture of what internal bleeding looks like. Here again I've included some more pictures. Next would be control of bleeding. Control of bleeding can be done by control using the airway, the blood vessel, or surgical resection. In the case of airway, we typically use bronchoscopic treatment. For blood vessel, we use bronchial artery embolization. And surgical resection is a mixture method in which both airway and blood vessel are surgically resected to prevent the bleeding. So over here, I've elaborated on the airway method of controlling the bleeding, which is by bronchial treatment. In massive hemoptysis, isolation of a bleeding segment with a balloon catheter may prevent aspiration of blood into the large airways, thereby maintaining airway patency and oxygenation. So what happens is we put in a Fogarty catheter and then we inflate it at the position where we would like to check, and the blood accumulates in this area, and using the Fogarty catheter we would then be able to locate actually where the bleeding is taking place, since the balloon, the Fogarty catheter uh, be um, would be filled with blood. So once bleeding has been stopped, it's best to find the underlying cause of the bleeding to prevent recurrence. Over here, I have added in two tasks for people to guess the type of bleeding. So for task one, patient has the following symptoms: pale and clammy skin, fainting and dizziness, tachypnea, drop in arterial blood pressure. Patient also has ground coffee-like vomiters and black stools. So in task 2, patient has the following symptoms: pale and clammy skin, tachypnea, and drop in arterial blood pressure once again. However, in addition, patient is also experiencing foamy bright red blood during cough. So I hope that both tasks were clear and you were able to identify the type of bleeding that is taking place. That would be all for my presentation today. Thank you.